All right, I'm going to walk you through how to do trigger point release onto the lateral part of your hip. So it could be your glute med, your piriformis, some of your deep hip rotators. But if you put your hand on your pelvis, even though we say put your hand on your hip, that's your pelvis, feel the bone through there. You're not going to be right on the bone, but just below it. So it's really like anywhere in this region here. So kind of that side of the hip and even into the back of the hip a little bit. Again, if you feel like you're just on like really hard bone, like your sacrum, or we call this the iliac crest, you're probably not going to get much out of that. It might just be uncomfortable. So you have to move it down a little bit. So again, you could be like right on the outer part of the hip or anywhere kind of towards the back side here. Okay, so you're going to use a tennis ball, a lacrosse ball. Those are good starting points. You're going to put the ball up against the wall and you're leaning into it a little bit. So I'm just kind of leaning my body weight into it. But the trick is, or at least how I tell people to do it, is have more of your weight on the leg you're not trying to roll, because you want that muscle that you're trying to find trigger points in and trying to release to be as relaxed as possible. So if you're just standing and gripping it and trying to roll on it, you're really not going to get much out of that because you have a really contracted muscle and you're trying to work on it. So you really want to bend that leg, soften it, put more of your weight on the outside leg or the leg that you are not trying to treat. From there, again, I'm leaning into the wall and you're in charge of how much pressure you're doing. So you want it to feel like, yeah, I feel like it's, touching a spot that's tender. So you're kind of rotating your body to find the spot. So there might be many, like I'm going to choose one right about there on me. Now, you don't want, as far as pressure goes, you don't want it to feel like, oh my gosh, when is this going to be over? Because then you're not really able, your body's like in protect mode and you're not able to create that relaxation of the muscle because it's too tender. So you don't want it to feel like nothing, but you also don't want it to feel like you can't wait till it's done. Okay, so once you roll to find the trigger point, excuse me, you're going to leave the pressure there. And I advise all my patients go into some breathing, inhale, fill your belly, try to really connect your brain to what you're feeling on the outside of that trigger point. And you're trying to, on your exhale, get the muscle to soften. Try not to tell yourself just to relax. That usually doesn't work. You can tell yourself to soften, release, where you feel the pressure of the ball. You can hold it there for 15 seconds, 30 seconds, a minute, whatever feels okay for you. If that leg on the outside is getting tired, give it a break, try a new spot, but see if you can soften or melt away that trigger point or tender spot that you have on the outside of that hip.